I'm just going to start by asking you, can you explain the relationship that you see between glucose metabolism and brain health?
Sure. So that's quite a big topic, of course, and I think it can encompass both the short term and sort of long term in terms of kind of brain health and things like that. So, I mean, everybody would be aware that, if your blood glucose is low, you're not going to sort of perform as well cognitively. And certainly if your blood glucose is high, if you have you have actually some established problems with glucose regulation, then that's going to be a problem too. So certainly sort of in the acute term, it's a problem. But I think that from my perspective, dealing in dementia and these sort of chronic disease states and things, it's more the long-term kind of sequelae of glucose dysregulation that's the big problem. And I suppose, when we think about the brain, as you've probably, of course, heard this before, but it's 2% of our body weight, but 20% or possibly even a little bit more of our sort of bodily energy requirements. So it's really very reliant on having a sort of consistent fuel source, but that also then means that it's kind of more perturbable by kind of changes in glucose levels as well. And so the brain is, there's three major energy substrates, I suppose, for the brain. So glucose is, certainly chief amongst them. Then there's ketones, and then interesting, there's some research around lactate, which sort of goes down the same sort of glucose pathway in a sense as well. But certainly the brain in general, in a normal healthy brain, runs quite well on glucose. I think there's some controversy really about whether the brain actually runs better on ketones than glucose in some settings, but I think it sort of makes sense from an evolutionary point of view that we actually have the ability to use both of those energy substrates. Classically, thousands of years ago, when we were much more used to having periods of kind of fasting and famine and all the rest of it, the body can then sort of kick in and use its fat stores and use ketones effectively for sort of brain function. But when glucose is sort of replete and it's abundant, then certainly the brain sort of runs pretty well on it. So so I think obviously this is kind of critical link, and I would certainly say that we can see changes in people's brains and their utilization of glucose, both in the process of normal aging, in terms of the ability of the neurons, the nerve cells, to kind of take glucose up and use it as an energy substrate. Also in certain neurodegenerative conditions as well. So Alzheimer's being, I guess, the core sort of dementia cause, if you like. And we can actually see changes in glucose metabolism on brain scans. So we can do these things called fluorodeoxyglucose, or FDG PET brain scans, which show that the neurons are actually just not taking glucose up as effectively as they would in a kind of healthy brain. So there's this definite kind of link between, poor glucose metabolism and utilization and poor brain health, and there's probably a number of different mechanisms behind that, which I'm happy to kind of talk about if you like.
Amazing. It's fascinating. I remember hearing, I'm not sure, 5-10 years ago or something, that everybody's talking about this kind of type 3 diabetes being this role of impaired glucose absorption or utilization within the brain, and the impact of insulin resistance on brain function. What's the latest in terms of what's going on there? Is it similar to that adiposity and what's going on in the liver in terms of inflammation and oxidative stress and poor detoxification? Like, what's the role of glucose and insulin within cognitive, I guess, performance?
Yeah, so I think there are lots of different mechanisms by which there can be problems, with too much glucose over the long term. I should make the point actually that type 3 diabetes, although I completely get where that's coming from, I don't really like the term very much, because type 1 and type 2 diabetes are kind of really describing the cause of the issue, whereas type 3 diabetes, it's not really describing the cause of issues, it's describing the consequence of a cerebral thing. But yeah, like I think in terms of the the problematic impact of glucose. So certainly we know people who have full-blown diabetes have much higher risks of kind of dementia and Alzheimer's disease and vascular disease. And there's probably links between, we know that chronic hyperglycemia can cause problems with high blood pressure. It can complicate dyslipidemia as well, with people with diabetes don't clear or remove their triglycerides as well. And certainly inflammation does definitely have an impact as well. And we know that degenerative diseases like Alzheimer's, this is really core neuroinflammatory element to it. So you need three things essentially. So you need the amyloid and the tau and then the neuroinflammation. And if you've got that inflammatory response as a consequence of too much glucose, and that's kind of a real problem. Then we know that sort of chronically high levels of glucose are directly kind of neurotoxic, and this is sort of linked between advanced glycation end products. And again, some of that's probably sort of mediated through inflammatory changes as well. We know that people who have high levels of blood glucose often have high levels of circulating cytokines as well. So IL-6, IL-1, TNF alpha and those kind of things. So this is clear sort of inflammatory link between the two things. Then there's the impact on the blood-brain barrier, which is really interesting. So the blood-brain barrier is this kind of very thin layer, obviously, between your bloodstream and the sort of brain sort of parenchyma. And that's very, very vulnerable to changes in kind of metabolic function and again, also inflammation. And there are some sort of fancy techniques that they don't really use them so much in this country, I think, but in America, where you can look at the integrity of the blood-brain barrier. And we know that it is prone to damage, essentially. One of the initial injuries to that may be kind of chronically high blood glucose levels. And then when you have a breakdown of the blood-brain barrier, you have this problem where the brain is no longer a kind of protected compartment, and you get this potential inflow, ingress of kind of metabolites and sort of problematic molecules that then further damage the brain as well. So that's kind of another way glucose is a problem if it's too high for too long. There's also an impact on mitochondria as well. And again, this is kind of another really interesting research with Alzheimer's disease, that a lot of people see it as what we call a sort of neuroenergetic crisis. And if you've got high levels of glucose all the time, that causes issues with your mitochondria. You're not able to kind of generate the energy for the nerve cells, and therefore they don't work as well, and they might even apoptose, die from things like that as well. And then you were mentioning about insulin. So, I mean, insulin, of course, can often be one of the things that kind of goes up before you even see the increase in blood glucose. So at the clinic here, we often do sort of fasting insulins as a kind of canary in the coal mine sort of test, as well as the blood glucose. And the sort of links, we know that insulin is really important for I guess a number of pathways which are beneficial for the brain, which help with things like synaptic plasticity, neuroplasticity generally, inhibition of apoptosis, improvement of kind of neurotransmitter sort of production and things like that. And so if you have chronically high blood sugar and then you have a reactive hyperinsulinemia, you're going to get a loss of sensitivity of some of those insulin receptors on the membranes of the nerve cells, which means those signaling pathways are deficient and defunct, and that kind of has a negative effect on brain health as well. And then the final, well, there's probably lots of other bits, but the other interesting element to all of this, I think, is around the enzyme that breaks down insulin in the brain, so the insulin degrading enzyme. So that's essentially that same enzyme that breaks down insulin, breaks down amyloid. So we talked about amyloid, being one of the causative proteins in Alzheimer's disease. And so if you get a high levels of circulating insulin, it's more competition for this insulin degrading enzyme, and then you get less breakdown of the amyloid protein, which builds up in the brain and therefore leads to potentially Alzheimer's if the other bits of it are present as well. So there's so many different threads. None of them are kind of completely orthogonal, but they're all relevant, I think, to long-term brain health.
That's amazing. Like I hadn't heard of that link between the insulin degrading enzymes and amyloid plaque. And I've also heard too that, we detoxify our amyloid plaque. We build it up through the day and we detoxify it through sleep. And we talk a lot at Vivalry about the role of glucose stabilization and sleep as well, knowing that particularly in people with severe diabetes. They'll often wake frequently because of the, either hypoglycemic events, throughout the night, etc. So there's just another pathway in which this kind of mechanism almost creates the perfect storm.
Yeah, I think that's right. No, sleep is such a kind of important, such a big kind of topic as well. And you're right. So if you're not sleeping well, your glucose regulation is going to go off. If your glucose regulation is not good, you're not going to sleep well, and so it sort of becomes this vicious cycle. And one of the things I'm particularly interested actually in about with sleep is this role of the glymphatics, which you may have heard of, where when you're in your deeper stages of sleep, you're essentially washing your brain of these pro-inflammatory metabolites and things like amyloid and tau. And if you're not getting a deep sleep, maybe because you're waking up sort of frequently because your glucose is not right, you're not getting that therapeutic brainwashing, and you accumulate these kind of inflammatory molecules, and that's really not good from a sort of brain health perspective. So that's certainly relevant. And then you have all the, I guess, kind of psychological and behavioral sequelae of not sleeping well, in that you get the a disruption of the ghrelin and leptin, the hunger hormones, and so your appetite changes, your body doesn't sleep well, so it kind of thinks the next day that it needs to get more energy dense foods, which are going to be a problem. Metabolically, your prefrontal cortex shuts down when you don't sleep, so therefore all that kind of judgment goes off as well. So there's lots of different threads to, I think, the impact of sleep as well.
Yeah, it's amazing. I never heard of like therapeutic brainwashing. We can't kind of let these cult leaders kind of learn about that.
Yeah, I guess it's funny. I think it was about 10 years ago they discovered this system.
Love it. Yeah.
Yeah, and it's such an elegant mechanism actually. And one of the other things that's quite interesting about the glymphatics is that possibly one of the reasons that amyloid builds up in the brain is because of the failure of the glymphatic system. And the glymphatic system is dependent on, to a degree, the pulsatility of blood vessels, which then essentially push the fluid out of the blood vessels through the brain, and then they take the stuff with them, the pro-inflammatory metabolites. But as you get older, and if you get vascular disease, maybe again related to sort of poor glucose control and things, your vessel walls become stiff. You don't get the same pulsatility, and therefore maybe you don't get the glymphatic wash that you would otherwise. That is then a risk factor for Alzheimer's. So another potential link.
Yeah, I love that term pulsatility too. Like, we kind of pulse to life as well. Like, we know dance is probably the best form of exercise for brain health and physical health as well. And there's so much in the literature about music and all of these things that keep societies and communities together, even singing together. That sort of pulse of life kind of creates this aliveness and vitality. And it's all I love all that interconnection. So that's a super cool system.
Yeah, and it's a shame that you're quite right. Dance is probably one of the best things you can do, because you're moving, you're coordinating, you're listening to music, you're socializing, all of that stuff, which is very unfortunate for me because I have very much two left feet. But I'm aware that it's probably something I should be doing, really.
Yeah, I mean, yes. Well, I was a dancer ever since I kind of got born, so it is, yeah. And I think too, even like from a mood stimulating kind of factor, like it's almost an instant, really, even when you do have two left feet.
Yeah.
You mentioned insulin, in your clinic, like actually looking at that insulin like a canary in a gold mine kind of picture. Do you have any other markers you kind of look for in that early, dementia prevention, cognitive decline prevention sort of scope? What do you do?
Yeah, so we certainly do that evaluation of metabolic health as best I can. So as well as checking the fasting insulin and checking the other kind of blood glucose metrics, if you like fasting glucose and HbA1c. We are looking at inflammatory markers as well as potential risk factors. So we'll do things like CRP and ESR, and quite tricky to get the other inflammatory cytokines measured, it seems. But there's kind of more basic inflammatory markers we like to get done because they're semi-relevant as part of the general approach to kind of optimizing cognitive risk factors. I always like to get sort of things like B12 and folate done because they're really critical. Vitamin D we get done because that's pretty critical as well. Magnesium levels, although there's some controversy about, you know, brain magnesium, tissue magnesium, blood magnesium and things, I like to get those things done as well. I'm really interested in the omega-3 fatty acids as well. And so I ship in a whole bunch of these omega quant sort of tests just to kind of give to my patients to get their omega-3 index done, because there's, you know, this very strong correlation between omega-3 fatty acid levels, vascular disease, the sort of synergy with the B vitamins as well. So I guess we kind of get a whole bunch of different blood tests done. There's sort of broad ranging, but also kind of quite focused as well, I suppose.
Yeah. I mean, diet's often, I mean, it's such an important kind of critical factor, and it's changed so dramatically, you know, in 50, 60, 70 years or so with ultra processed foods. But, you know, add that to our lifestyle, our busy lifestyle, you know, needing some sort of convenience. We don't have time to kind of ferment and, you know, make our own, you know, things from scratch as much as some people do, but, you know, many people don't. How do you see the role of diet and nutrition in supporting our brains, and what's happened over the last 50 years? Like, what's going on?
Yeah, I mean, it's huge. I mean, I think, you know, really diet, exercise and sleep are just that they're so important to kind of brain health in the sort of longer term. And yes, the change in kind of landscape from a kind of what's available commercially, the ultra processed foods. We know there are umpteen studies now kind of looking at the negative effects of ultra processed food. There was even something fairly recently that talked about, you know, if you have the equivalent of like a rasher of bacon, you know, 25 grams of processed food a day, it kind of almost increases your risk of dementia by 40% or thereabouts, you know. So there's this huge link between, I guess it's probably in part the inflammatory component of these ultra processed food, but also the fact that they're kind of, you know, nutrient poor and so on. So those kind of moves have definitely kind of caused problems. There has been a sort of demonization of fat, which I understand. I think there's a lot of nuance to that, but I'm not actually one of these people that necessarily advocates for a lot of saturated fat, because I think there's still concerns about having too much of that. But I think people stop having even the healthy fats, which are kind of really important as well. So the omega-3 fatty acids are part of them, but, you know, all of the other PUFAs and MUFAs and things like that from nuts and olive oil and avocados, those sort of things. So I think that's relevant. I also worry a little bit about just the nutritional content of our food as well. And, you know, this is a controversial topic, but about the depletion of the soil microbiome and whether we're actually getting the nutrition in the vegetables that we once got, and how that then might sort of impact upon brain health and all kinds of kind of chronic disease states and things like that as well. So there's lots of different ingredients, I think, which are really important from a dietary perspective. The research is a bit tricky because most of it is observational, just because it's quite tricky, as you know, kind of doing sort of research on diet, and you're often relying on people's reports and you're assuming that they're consistent with what they say they're eating and so on. So causality is quite hard to determine. And I think that's probably one of the reasons that so over the last few years that the Lancet has commissioned this kind of report on modifiable risk factors for dementia, and diet still is yet to get in there. And, you know, which seems crazy to me, but I think it's because of the difficulty kind of doing the research. Having said that, like I do think there are certain dietary patterns which seem to be clearly kind of associated with better sort of brain health. And so when I'm talking to people in the clinic here, I very much talk about the MIND diet, because I think that's probably the most evidence-based thing. So the MIND diet is a complicated acronym which stands for the Mediterranean Intervention for Neurodegenerative Delay, being a dietary approaches to stop hypertension. So it's a very complicated acronym, hence MIND diet. But it's a kind of Mediterranean style diet that really does a good job of kind of reducing vascular risk factors. And so when people ask me about dietary advice or, you know, a basic level dietary pattern, I still tend towards that more than anything else.
Yeah. I know it's complicated, isn't it? And I think also the fact that the research, you know, the dietary research is so difficult to get in the realm of the randomized controlled trials, we've sort of created as a health profession this void between diet and disease, because we can't get the level of evidence that people kind of, you know, like to acquire that we can with, say, a atorvastatin or, you know, some sort of, you know, drug or other intervention. And it's a great point, actually, that, you know, we're always, so diet in terms of its emphasis is actually often at the bottom of the list or doesn't even make the list. And therefore, you know, there's this kind of attitude that, you know, eat whatever you like. It's not really going to make a huge difference, but make sure you do the Sudoku or, you know.
Yeah,
So,
and you're
yeah,
right, and it's crazy. I mean, we don't have any RCT that proves that smoking causes lung cancer, but, you know, we accept it does. And I
yeah.
think in a kind of very intuitive way, we all realize that diet has a kind of profound effect on brain health. But yeah, I mean, there's no money in it for a start, you know, so that probably doesn't help the kind of research side of things. And they're just hard studies to
They
kind of
are.
do. So
Yeah. And so labor intense, the studies as well. So, but I mean, I think the beautiful thing is that, like, if we can convince our patients to even just try a diet, you know, when they actually, you know, start laughing a little bit more, and their aliveness and their energy is a little bit better, and they're not quite so irritable, and they're sleeping better, and then they can actually have that personalized experience of what a good diet does for their overall
yeah,
health. And you can never take that away. It doesn't matter how many randomized controlled trials that you've got.
that's very true. And yeah, so you need to give them some much more immediate, obvious improvement.
Yeah.
So the challenge in the dementia space is, you know, I'll see people in their 50s who are cognitively relatively normal, and these are motivated people because they've got a family history. But then you're saying to them, well, these are things you have to do, and you need to sustain them over 20 years to know whether they're actually going to help or not. And so that's really tricky. So you have to kind of give them, as you say, a bit of a carrot. And we do know that the dietary interventions they pretty quickly sort of turn a whole bunch of different stuff around. I'm sure you're probably familiar with Felice Jacka's work on the SMILES trial and how that can improve depressive symptoms in people, you know, simple dietary changes and things like that. So yeah, if you can hook people in to begin with and give them some immediate rewards, also knowing there's a long-term reward, that's, I guess, the key to it.
Yeah, amazing. And tell us about depression and cognitive decline. Like, what's the correlation between that? I mean, we've got mental health epidemic, we've got loads of people on antidepressants, you know, anxiety's through the roof. We've got our kids and our teenagers, you know, in the worst mental health ever in human history. A recent research study came out last week. So what's going on with mood and cognitive impairment or dementia? Do we know?
Yeah, so it's quite complicated, the link between both depression, I think, and also anxiety and sort of dementia and neurodegenerative problems, in the sense that we know that sometimes those psychological symptoms can be the harbingers of later problems. So, you know, if somebody develops depression in their 50s and they go on to develop dementia, is the depression the risk factor, or is it actually the very early stages of the degenerative kind of process? So it's kind of hard to pull it apart. But I think when we kind of look at, I guess, the more basic science research and the mechanistic data, we can see that these mental health conditions, I guess, are associated with clear biological changes that would then put people more at risk of memory problems. So talking again about inflammation, you know, with that people who are in a depressed state, you know, may often do have kind of higher levels of inflammatory cytokines again in their system, and then that's obviously not going to be good from a kind of neurodegenerative perspective. We also have shown on brain scans that the volume of people's hippocampi, for instance, which are those critical structures for memory that often atrophy, you know, when people are having sort of Alzheimer's disease, the volume of those is reduced when people are in states of depression as well. So there's that kind of neurostructural kind of link between the two things. And interestingly, if you then treat the depression, you know, the volume of the hippocampi may actually improve to a degree as well. So that's kind of a hopeful thing. But there's definitely kind of a link between, I guess, mental health sort of perturbations, if you like. I always kind of find it, I think it's important to kind of make the comment that we don't have research to suggest that every day fluctuations in mood or anxiousness and things are very positively correlated with dementia and so on. And people obviously get freaked out. I think every time I have a bad day, what does that mean? Brain. It's not quite like that, but it's much more the kind of protracted issues that people have that are, I think, the risk factor more than anything else.
Let's talk exercise. We mentioned it before, but such a powerful influencing factor on glucose metabolism, on brain health. I was so excited when I discovered how impactful exercise is for brain-derived neurotrophic factor. And also, the other influencing factors on that particularly beautiful fertilizer for the brain. But how do you see the role of exercise in dementia prevention?
Yeah, so, well, if people ask me, give me one thing that I should do, and I just say exercise. But it's as simple as that. I think, diet is up there, but exercise to me is kind of the key thing. And I think when we look at the research, looking at preventing cognitive decline and even actually reversing decline to a degree in people who already have, mild memory problems, exercise, I think really clearly sort of has the advantage over a whole bunch of other things. So as you say, I think building muscle bulk is good from a kind of glucose sink kind of perspective. So that will improve metabolic function. And we know there's a link between muscle mass and brain health as well. So there's this kind of idea of, if you have sarcopenia, you're much more likely to develop dementia. This concept of cognitive frailty as well. And so if you have more musculature from kind of exercising, your brain is going to be better off from it. Interestingly, possibly more lower limb muscle bulk rather than upper limb, simply because of the bulk of the muscles and how that's kind of beneficial in the lower limbs. So there's the kind of the muscle bulk side of things, and then there's the release of the myokines, so things like the BDNF and various other kind of neurotrophic factors that come about with exercise as well. In high intensity exercise, we talked about lactate at the very beginning. There's something quite special around lactate, I think, and brain health. And so I'm very much an advocate of people doing high intensity exercise if they can do it. A lot of people don't want to do it, of course, but I sort of say to people, my basic advice around exercise is, if you can pretty much every day do 30 minutes of moderate aerobic exercise, that's a good base. And so that's, to the point where you can speak but not sing. That's kind of the basic idea with moderate. More officially, probably zone 2 if you're using your pulse rate as a kind of guide. And then high intensity at least a couple of times a week, and then some resistance training to build your kind of muscle bulk up as well. But I just think it makes such a kind of profound difference to people that, I'm a huge advocate of it. And it's one thing you can do, that's what you should be doing.
Well, it's a bit like the diet too, because when you do exercise, your mood, often lifts. I often arrive at the gym and people are a bit shy, and by the end of it, everyone's sort of high-fiving, there's lots of smiles, and the mood is elevated within 45 minutes. And it's and then group training, so using other people to exercise with, increases that social factor as well. So what about the role of stress, psychological stress, emotional stress, like work stress? Australians are some of the longest working people on the planet. We're all a bit kind of under the pump, and COVID sort of, created this explosion of it. What do you think the role of psychological stress is in these kind of neurodegenerative diseases?
Yeah, so I think it's similar to the sort of conversation around the depression, and I guess stress can be a synonym for anxiety to a degree. So similar mechanisms, I think, in terms of sort of inflammatory changes, elevated levels of cortisol and all of those kind of things. And again, there's research to suggest that high levels of continuous sort of anxiety and stress are a risk factor for degenerative disease later down the track as well. You have that same confounder, though, that you did with the depression, is that, is the anxiety the first symptom? So yeah, look, I think stress is a big player in all of this. interesting that you talk about Australians, working the longest. Like there's nothing actually wrong with work. You've just got to, in fact, it's really important to work, but you just need to kind of make sure it's manageable. And there's research to suggest that people who retire early actually have higher rates of dementia, for whatever reason, loss of meaning, loss of social contact, loss of purpose, loss of complex mental activity, all of those kind of things. So the message is probably not so much about retiring early, but it's about kind of just trying to manage the stress that kind of occurs as a consequence of that kind of working life, I suppose.
Yeah, it brings back that kind of idea of like that proper, rest for 8 hours, sleep for 8 hours and work 8 hours. We seem to kind of forget that, particularly with modern technology. People are working. I mean, a lot of the people that I know, they want to work hard when they're younger, to almost, it's like and then stop. Oh, I got a bit of feedback then. So yeah, that's interesting about, maybe semi-retiring until the ripe old age, which is great advice as well. So what in the early, like if you've got a young person coming into your clinic, how would you start someone off? Like, what are the other factors that we haven't spoken about in terms of those, critical 4 pillars? Is there anything in the literature to tell us we should be doing this and not doing that?
Yeah, so I mean, I guess it comes back to that Lancet Commission report. So they've identified, it was only a month or so ago that they released the most up-to-date report, and they sort of identified these 14 modifiable risk factors, which, as I said before, I think it has relations, diet's not on there, sleep's not on there either at the moment, but they kind of identify a whole bunch of things which are often lifestyle related, which really need to be kind of looked at. So, and they kind of do this life time frame, if you like. So education, that's really critically important, and sort of comes back to this sort of concept of cognitive reserve. So I think people having a cognitively engaging job, or just some pursuits, doesn't necessarily have to be a job, but that's really important, and that's something you need to kind of sell the message about, I think, from a fairly early age. And we know that people that, I guess, essentially forced to kind of think harder about things, they have richer neuronal connections, which means that for any specific level of damage to the brain, whether it's through amyloid or tau or whatever, they've got a greater ability to compensate. So I think, education plus kind of complex work environments that aren't too stressful, that's really important. Head injuries, there's been a lot of stuff about head injuries in the press recently in the context of AFL players and other sports players and things like that. So avoiding head injuries is really important. I kind of went through a bit of a dilemma with my kids who play soccer, whether they should be playing soccer because of the heading the ball. And actually, years ago, before the whole head injury thing came into focus, I worked in a memory clinic in northern Wales, and I saw this disproportionate number of elderly men who'd been semi-professional football players, soccer players, and they all had cognitive problems. And not only was it just the heading, but Wales is very wet, so they get these damp, old leather balls and just literally heading 5 kilograms of weight every time. And I'm sure that's kind of had a problematic sort of effect. So education, head injuries, exercise, diet, and sleep, we've talked about, alcohol and drug use. So I think there's been a lot of wishful thinking with the alcohol research, that maybe a little bit is okay, but better than none. I just think the more research we're doing, we just can't hold on to that hope anymore. Yeah, it's probably true that some people can cope with alcohol better than others. And one of the other things I do in my clinic is a genetic test, an ApoE genotype, which I am a big fan of doing this because I think it influences decisions and advice around lifestyle. But people who have the E4 gene, I think you've got to be really kind of careful about alcohol intake. So it's generally kind of pretty damaging, alcohol, unfortunately. So you have to have a conversation around that. Hearing is another thing. So hearing, and actually in the most recent Lancet Commission report, visual loss as well. So both of those things are risk factors. So, I'm guilty of this, but people walking around with AirPods, listening high volume to things, from an early age is probably not ideal either. So yeah, I guess those are kind of a selection of things we're having conversations about.
That's amazing. I mean, like everything, all chronic diseases start really when we're young. It's just really difficult to try and get a teenager not to use those iPods and listen to loud music.
Yeah. Well, one of the things actually that I think may change with all of this is we can do in the research world, at least, we can do amyloid PET scans now. So we can actually look at people's brains and look at how much amyloid they've got in their brain. And we know that the more amyloid you have, the more at risk of dementia you're going to get, and of Alzheimer's disease specifically. And you can do amyloid scans of people in their 40s and 50s and show the amyloid that is already there. So the neuropathological substrates to all of this sort of stuff develop decades before the actual symptoms kick in. So as a motivator, like I really like the idea that you can, essentially get people maybe in the 40s or so, do a brain health check their brain amyloid, check all these other risk factors, and then be able to motivate them to kind of make changes.
Well, it's a bit like having your cholesterol done, really, isn't it? Like in having your blood pressure done, and sort of looking at those kind of trends over time to that. So is there anything, like, what other factors do we need to kind of think about in terms of that? Like, bring it back to glucose is a really great kind of metric to sort of, get people going and have a look at some of those key kind of pillar factors. Is there any other factors that we need to kind of consider that we haven't mentioned?
I suppose it's good to kind of recognize the importance of social connection. So you talked about the dancing side of things, and I think that is one thing that's really been overlooked, again, because it's a bit softer, as a kind of a metric. But we know that people that is probably mostly the subjective feeling of loneliness rather than necessarily the amount of actual social contacts that you have. But we know that if people report feeling lonely, that they, again, have higher levels of these inflammatory molecules in their bloodstream. And we also know that they have higher risk of developing neurodegenerative disease. So that's the other, I guess, element to things that I think is really important. And I deal a lot, of course, with the elderly, and their social circles tend to diminish for obvious reasons sometimes. And then that means that, the loneliness becomes a real problem. And I've seen people that their cognitive function improves out of sight, when you kind of get them engaged in sort of community groups and that kind of thing. So I think that's the other sort of element to this. And of course, I don't really want to demonize technology too much because I love it, really, but I think there's so many good bits to it. But it is a problem in this regard, in the sense that I think young people possibly are less inclined to kind of socially connect with each other because they're much more happy to just kind of be on their phone. You get that immediate dopamine surge. You can see how seductive it all is. There's no real need to kind of work through social anxiety and difficulties in social situations if you can just turn to your phone. So I just think that that's contributing to a whole bunch of other sort of problems as well. So it'll be interesting to kind of see how things go with all of that. But I think screens are an issue for a number of reasons.
Yeah, they're very addictive and seductive and very low, have a low level of complex involvement, really, that kind of like scrolling and lack of processing time. Even some of my algorithms might be like beautiful quotes from Carl Jung, but the next one's Thich Nhat Hanh, and it, you don't get to kind of sit with like Carl Jung and what he said, and how like important it kind of is from a process and perspective.
Yeah.
I love your point about loneliness too. I mean, there's a thing in a report in the News GP this morning about this epidemic of loneliness, and just really talking about that worldwide of what we're going on, as we get busier and life is stressful for whatever reason. The elderly are really missing out on that critical social time. And even the fact that we refer to people as old people rather than elders, and wisdom keepers, I think we could really turn around that generational divide if we could change the name from old people to the elders.
Yeah. Yeah, it's a good point, isn't it? And it makes me think about this is not necessarily related to brain health, although it kind of is, but about the blue zones, the sort of
Mm.
this proportion of centenarians, and really one of the key things there is that sense of connection and community and purpose and things like that. So there could be other things, of course, there, but I just think it's such an innate human need, isn't it, to be connected to people. So
Yeah, and I think we all know, even all of us listening, like, we look in the mirror sometimes and I'm like, I still feel, 30, but I'm not looking 30 anymore. So, we all have this kind of, we don't grow older inside. We just grow older on the outside.
it's very true, actually. And I remember when I was in my mid-20s thinking how disastrous it was going to be when I reached my mid-40s. And then I got to my
Yeah.
mid-40s. I have a completely different mindset. I actually feel okay. So it's a perspective thing. Yeah.
Absolutely. Yeah, fantastic. We've got a question actually from the audience about the role of meditation and mindfulness training and breathing and those kind of, I guess relaxation, deep relaxation, insightful practices. Is there much research in regards to that and cognitive health?
There is a bit, and I think that's a great question, actually, because I mean, there's the evident obvious sort of stuff around, I guess, stress reduction and things like that. But when you kind of look at what it's doing at a biological systems route, I think that's really interesting as well. So even just that process of trying to get more in the way of that kind of exhaling the parasympathetic activity and the stress reduction that comes with that is, I think, sort of profoundly kind of helpful for people. And they have shown, I think, that people that have this pattern of adaptive breathing that embraces those things actually often do have better cognitive function. I'm not sure we have evidence to say it reduces the risk of dementia, but we definitely know, cognitively it can improve things. The other thing around meditation specifically is it's probably one of the only things that seems to globally improve attention. So, the multiple things that kind of might help a little bit, but when we're kind of looking at just overall improving attention, then the meditation is probably the way to go, because it's sort of strengthening the network between your prefrontal cortex and the deep brain and things like that. And you really need that prefrontal cortex to kind of be able to maintain attention and so on. So that's, I guess the other real sort of benefit of meditation and mindfulness, as far as I can see. Yeah. And then meditation and mindfulness can take any forms, of course, it doesn't necessarily have to be sitting in one place quietly, just whatever works for people, really.
Fantastic. So I might hand it back. Thank you so much, Kailash. Amazing. Charlotte, did you want to add? She's always got some burning questions, so I'll let her have a go.
I've been taking notes as we go. So thank you both so much. There is clearly an area that's got so many moving parts to it, and clearly something that could affect everyone, really, when we're talking about it, in terms of the lifestyle factors and those risk factors. The one thing that sort of I was curious about, is there any evidence around caffeine and brain health?
Caffeine?
Yeah.
Yes. So again, I think that the research is sometimes difficult to do with these things in terms of knowing causally whether caffeine consumption maybe can help with reduced dementia risk. But the research does certainly seem to suggest that's the case. Up until very recently, there seemed to be very few downsides to drinking probably up to about 4 cups of coffee a day. There was something that came out, very, very recently, literally last week, that I was kind of just looking over, which I think maybe talked about sort of cancer risk in excessive use of coffee, particularly. But prior to that point, it all seems to be, as long as you're not especially prone to anxiety or cardiac kind of rhythm issues, caffeine seems to be a great kind of source of I guess, well, it's nutrients for your brain health. There's also the in coffee, but then there's also the caffeine component as well. So yeah, I'm a big kind of proponent of caffeine, as long as you don't get those kind of, I guess, problematic sort of reactions to it and things like that. If you do, but you still want all the polyphenols, which coffee's got to offer, of course, you can go down the sort of the decaf route and things like that. So there's benefits specifically to coffee, both from polyphenols, but also the caffeine content. But yeah.
That is the perfect answer. Thank you. So we've had a question. Can you expand on lactate and the brain? How does it benefit the brain? And that apparently there are trackers for this, for your lactate levels.
Yeah, I haven't had any personal kind of experience of lactate sort of trackers, but I mean, you can, like, I believe you can do your finger prick tests as well as kind of, you know, maybe some, you guys might know more about the wearables than me, but yeah, look, it's an emerging area really, and I think all we can really say at the moment is when people, and you would know this, you know, when you exercise kind of briskly, you do feel kind of mentally kind of more alert and things like that. So there's something kind of special around the lactate production and acute improvement in cognitive performance. And maybe that, again, that comes back to some of those evolutionary kind of concepts of, you know, if you're being tracked by something in the wild and you're having to really, you know, run very fast away from it, you also need to be very mentally alert, kind of, because there's threat in your environment. So maybe it's got something to kind of do with that. But I mean, lactate essentially sort of converts through the glucose pathway in a way. So it's, you know, it is glucose versus ketones, but lactate's just the kind of, I guess, source of the glucose in a way. I don't know that we've got a great deal of evidence to talk about lactate specifically being beneficial in terms of dementia risk reduction. I don't think the research is there, but at least acutely we know it's metabolically a very helpful molecule.
Fantastic. So one of the questions that I did have as well regarding diet, so the number of older patients that I work with who kind of resort to the tea and toast diet after a little while, and we're getting some glucose dysregulation. What are the sorts of, if you were to give them 3 tips around diet, where would you start?
If you're talking to somebody who's a bit older?
Yes.
Or, yeah, okay. Well, one thing I would say, which I think is often overlooked, is about protein, actually. And I think that's a really important thing to kind of tell people who, again, are maybe a little older and they're more prone to that kind of losing muscle mass and things like that. So I think an adequate supply of protein, and wherever you might get that from, is really very important. And I just mentioned that from the word go because I think that's something that's often overlooked. So that would probably be certainly up there in terms of my advice. Clearly, you know, we're wanting to avoid too many processed foods. The refined kind of carb stuff obviously is a problem as well. And then, yeah, I guess the other advice would be around making sure you've got a decent level of kind of healthy fats in your system. And, you know, we know 60% of the dry weight of the brain is fats. So people, yeah, this kind of demonization of fats I was talking about before is kind of unhelpful in some ways. So those would probably be my kind of main thoughts. And then, you know, eat the rainbow, have a diverse selection of vegetables, particularly fruits. You know, a bit more controversy with fruits, particularly the kind of the high GI kind of fruits and things, I suppose, but they're a wonderful kind of source of, again, polyphenols and so on. So getting that good spread. There's actually so many things, actually, thinking about it, because there's fiber as well. Now, fiber, again, slightly controversial topic, but I think, you know, there's the microbiome connection, there's the cholesterol connection with fiber as well. And although there are some people that feel it's completely unnecessary, I think we do have evidence to suggest it's really kind of beneficial for chronic disease management and brain health as well. So that's probably something else I would mention.
Fantastic. Yes, they're all the things that I like to start with. Unfortunately, they're all the boring things. People don't necessarily love being told to eat more vegetables, maybe a bit more lean proteins. I'll keep trying, but it's good to know.
It is true. I suppose the only other thing there would be around, you know, trying to use spices and herbs and that sort of stuff to kind of make these, yeah, fundamentally boring things kind of a bit more tasty. And the spices and herbs themselves have real benefits. So turmeric, you know, curcumin has actually been shown in research to be really beneficial cognitively and probably through an anti-inflammatory effect, and may reduce the risk of dementia as well. So there's, maybe that's a little twist, but yeah, it's always a bit of a hard sell.
Yes. So we've had another question. So any thoughts on caffeine and the stimulation of norepinephrine and its implication on cognitive decline?
So I guess I'm not sure I have anything kind of specifically to kind of add above and beyond what we talked about with caffeine before. I mean, I think stimulation of those neurotransmitters, whether it's noradrenaline or dopamine and things, I mean, that all of that stuff's very kind of important. But I don't know really enough to kind of know whether that's the pathway through the sort of cognitive decline and risk reduction occurs. So yeah, I might have to come back to you on that one.
That's all right. Thank you. And do you have any good resources for the Mind diet? Where can people find information about that?
Yeah, so I mean, you can actually literally Google MIND diet, and the information will be there. So it's quite a proscriptive diet. So it is really quite directive. So there's like 6 lots of green leafy vegetables a day. I think there's a couple of serves of berries per week. There's 3 serves of whole grains per day. So it's very, very specific. But you can find this fairly sort of freely available online. And the Mind diet, like the study I think it was originally done on the Mind diet, showed that people that adhered most highly to the Mind diet had brains which were the equivalent of 7.5 years younger cognitively than those who were not adhering to the diet. So it does seem to be really a very kind of good diet for the brain.
Fantastic. That's interesting to be able to use that as our selling point. The 7.5 years younger. I mean, how can we argue with that?
Yeah. Well, you need a metric, don't you? Just like that's the beauty of the CGM and things. You've got some data. You can kind of then have a conversation around it.
Yeah, and just on the CGM side of things, I'm looking at people's data every day, all day, and so many people report this brain fog or this the memory issues associated with not only that rise and rapid rise, but also the big crash that can happen afterwards. Can you explain why they might be getting that experience of the brain fog?
Well, yeah, brain fog, unfortunately, it's a rather nebulous term, isn't it? But I mean, I guess, perhaps what is kind of happening is when you're having that crash, you've got this overcompensation for the high glucose, which is then kind of driving down the available glucose kind of in the nerve cells and things like that. And therefore, you're getting this problem with the energy substrate again. This is one of the rationales behind the keto diet, of course, is not that I'm a massive fan of it, to be honest, for otherwise healthy people, but to become more able to be metabolically flexible and use fats as your kind of energy substrate. But most of us, I think, are rather kind of glucose dependent in terms of our kind of energy needs, and so we're operating with this assumption it's always really abundant, and then when it comes crashing down, it's just the brain just doesn't function very well.
It's quite interesting working with people, again, seeing the data in front of them and asking the questions, how do you feel when this is happening? Because we don't always have the data, and being able to make those changes accordingly. And what they report is quite significant changes in energy and focus and all of those other nice things that we're after.
Yeah, and that, that's the real extra benefit over and above, I suppose, what I would ordinarily do day to day in my clinic, which is not the HbA1c. You're just getting snapshots, and the HbA1c will measure your 3-month average, but you're getting no sense of whether there's these kind of spikes going on. So and I think I would imagine they'll be doing more research of the actual specific impact of the glucose spikes rather than the kind of average glucose when it comes to brain health. I think we're still in the early stages of researching that sort of stuff. But I just think it makes obvious sense to try and track it as closely as you can.
I think these are the things that we can change early on as well. So we can get people in their 20s and 30s starting to understand the impact of diet and exercise and sleep, and making it more real, I guess. So because it's tangible, we can see it and we can work with that information as well.
Yeah, I agree.
But thank you so much. I have learned an incredible amount today. Thank you both, Kailas and Michelle. So we will be sending out the recording of this video at probably next week it will come out. So if any other questions pop up, please feel free to pop them into our Facebook community online. And we will be doing one of these fireside chats every month coming up. So keep an eye out in your emails for when the next one will be. For those of you that would like more information about Kailas and what he's doing, you can find him at yourbrainmind.com.au. And can I just, Kailas, can I get you to tell us about that app quite quickly as well, the app that you've developed?
Oh, yeah. So very briefly, yeah. So it's on iOS, so you can get it on a phone, or an iPhone or an iPad, but it basically just goes through your cognitive or risk factors for cognitive decline, and it's free to kind of you essentially get a sort of cognitive score based on, you know, where your risks are, and then it kind of delineates in what area of your life, and this includes things like medical conditions, medications and stuff, which we obviously haven't talked too much about today. And then so it gives you sort of red flags, the areas you need to work on. And then for, I think, like $6 or something, you can get access to kind of evidence-based tailored advice on what you should be doing. So yeah, I'm keen to get it out there. To be honest with you, I created it about 2.5 years ago. And it's kind of just been latent. So it'd be nice nice to get the message out there. So anybody wants to download it, even the free bit, and just review it, it'd be wonderful.
Yes, and that one was called Brain Scan, is that correct?
Brain Scan, yeah.
Fantastic. I have done the free part myself. It was really interesting how many factors to look at. So I definitely encourage everyone to check it out and keep it in mind for your patients as well. Thank you so much, everyone, for your time, and enjoy the rest of your afternoon. I look forward to seeing you next time.
Thanks, everyone. Bye. Thanks so much. Bye.